Hey everyone, this is Ben with RegisteredNurseRN.com, and in this video I'm going to talk a little bit about Couvade syndrome, also known as sympathetic pregnancy or male pregnancy symptoms. So what is Couvade syndrome? This is a condition in which men begin to experience abnormal symptoms that mirror the symptoms of their pregnant mates. And it sounds a little bit crazy, but I can assure you this is actually a real thing. As a matter of fact, I experienced this a little bit during my wife's first pregnancy, but this time around, both of our symptoms were quite a bit more intense during that first trimester. And so this is something that people actually experience. In fact, it's a lot more common than most people think. One study found that as many as 72% of expectant fathers suffered from at least one symptom of Couvade syndrome. Okay guys, what are some of the signs and symptoms that you are experiencing Couvade syndrome? Well, like I said, the first time around, my symptoms weren't that severe. They mostly included a metallic taste that I had in my mouth for a month or so. I also noticed an increase in food cravings and food sensitivities. And I also had a little bit of fatigue where I would take a nap when usually I don't take naps. But this time around, my symptoms are much more exaggerated. So what are they? First, I noticed a definite increase in my food cravings and my appetite. I would be going through the cabinets looking for food, scrounging around, and my wife would laugh at me because I was eating all the time. And I actually gained some weight during that first period. One of the strange symptoms that I've experienced this go around was nipple soreness. And my nipples would just become very sensitive, almost like I was going through puberty again. And what I found really strange about this was when I got on and researched, I actually found out that according to some studies, one reported symptom was breast enlargement among men, which I thought was just crazy, but thankfully that didn't happen to me. I'm still the same cup size. I also experienced debilitating exhaustion for probably a month and a half, and it was so bad that I could barely get anything done, and I almost never take naps ever, but I was taking naps pretty regularly there for a while, and so just extreme exhaustion during that first trimester definitely hit me hard. I also have a lot of food sensitivities and food allergies, and those went absolutely berserk. I mean, I could not eat anything other than white rice, a few vegetables and a few fruits and turkey. That was pretty much all I was eating, and anything that I would eat would upset my stomach. I would go from having horrible bloating and gas. My bloating got so bad I actually looked like I was showing more than Nurse Sarah for a while. Like my stomach was just pooched out all the time, and I would get diarrhea if I ate anything even remotely off of my super strict diet that I had to go on just to cope with the stomach GI issues. I also experienced nausea and headaches. In fact, I had my face over the toilet one day almost throwing up. That's how bad the nausea got, but thankfully I never threw up. I also experienced mood swings where I would just have intense bouts of irritability and the slightest thing would annoy me. And I also had some insomnia where I would wake up for anywhere between 1 to 3 hours in the middle of the night. I could not sleep for 1 to 3 hours, but then finally I would usually fall back asleep. And then finally, I had a lot of random body aches. My joints would ache, my body would feel really fatigued, and things like that. So those were the main symptoms that I've experienced with Couvade syndrome. I've also read a few other symptoms online that some men experience that I did not experience, and some of those symptoms include swelling in the hands and feet, labor pains or contractions which occur during delivery. I'm hoping I don't get that. Postpartum depression, nosebleeds, and more. So what causes Couvade syndrome? Well, researchers aren't exactly sure what's going on. There have been some people who have speculated that it's a psychosomatic thing or some kind of weird guilt or fear over being a parent. I don't think that's true in my case, but some research has shown that men do experience fluctuations in their hormone levels. For example, researchers have performed studies that show that expectant fathers experienced a drop in testosterone and cortisol levels and an increase in estradiol. So it's hard to say for sure what exactly causes it, but I do think that somehow I can sense her hormone levels and that they have somehow caused my body to react in a way so that my hormone levels begin to fluctuate and sort of sync up with hers, which is really weird. Now, if you are a guy who is struggling with Couvade syndrome thanks to your pregnant mate, I've got a few tips that hopefully will help you out. The first thing I would just say is that you've got to try to mentally remind yourself that this is going to pass, because the worst of the symptoms usually occur during that first trimester. So once you get past maybe week 12, 13, 14 or so, usually the symptoms will begin to slowly subside. And that's what happened with me. I could suddenly get a little bit more work done. I wasn't as tired and fatigued. And even though I still have a lot of food sensitivities, they definitely have decreased a little bit compared to what they were. So if you can just remind yourself to hang in there, you just got to let the time pass, and then you'll probably feel a lot better. Next, if you do start experiencing severe GI issues, like you get diarrhea or cramps or bloating or constipation or something like that, you can always try experimenting with probiotics. Of course, you always want to talk to your doctor and all that before you start taking supplements, but Culturelle, Digestive Advantage, Align, those are some popular probiotics on the market, so you might want to experiment with those. They might help calm your stomach down a little bit. Also, switching my diet to a more hypoallergenic diet definitely helped out a lot, where I was eating basically just white rice, a few vegetables, a few fruits, and turkey. That's basically what I was eating, and that definitely helped calm my stomach down. Now, if you feel a bout of nausea coming on, you can always try to eat a little bit of food to help you out. Also, I found that overeating actually made my nausea worse. So you want to space your meals out, try not to overeat or go too long of a period without eating. Now, as far as the fatigue is concerned, try to cut back on some of your workload if you can, and on your days off, just rest, take naps, and rest as much as you can. Okay, so that wraps up this video over Couvade syndrome, and those are some of my symptoms and my experience with it. I would love to hear from some of you guys out there. Have you experienced this? And if so, what were your symptoms? Ladies, if any of your men are doing anything weird during that first trimester, it could be Couvade syndrome, so check it out. Also, I would say that this condition has given me a totally new respect and has given me new perspective on what a woman has to go through just to bring life into this world. So hats off to all the ladies out there who have gone through a pregnancy. It's pretty rough, and I definitely feel your pain a little bit more now. So thank you all so much for watching, and please subscribe.